My name is Rick Huneycutt. I'm a doctor of osteopathic medicine and family medicine with Prisma Health. So I guess outside of work, I'm a big traveler. From a very young age, my father always took us on long, road trips across the country. And so as I've grown up, I've always loved going to different places. I've been out of the country, been to the UK, Guatemala, El Salvador. Recently went on a great trip to Alaska. So I guess when I get time off, for a few days, I'm gonna go somewhere. And if I'm not doing that, you'll probably catch me playing tennis. Originally, I'm from North Carolina, a small little town of Albemarle, North Carolina. I usually just tell people when they ask me, where's that at? I tell them near Charlotte. So I grew up in that area, went to undergrad at Western Carolina University and actually majored in forensic anthropology. And so the tale of how I went from that to family medicine would take way too long for this purpose. But then I went to Spartanburg at Edward Via College of Osteopathic Medicine for my medical training, did residency actually in Sumter and stayed to continue practicing here. Family medicine, I think, is one of those specialties that you don't really choose. It kind of chooses you. In residency, I really didn't know what I want to do, and then I did my family medicine residency with one of the local physicians and really just kind of fell in love with it. Family medicine is kind of like the front line of medicine. Our big thing is preventative medicine, keeping patients out of the hospital, out of the ER, and to manage those kind of chronic medical conditions. So family medicine is really the place where you get to know the patient, you get to know their history, their family, and you do the best to keep them in the healthiest, form that they can be in. Educating patients it's been a problem for most physicians for many years, and there's kind of a nuance coming into it, and that it's really important that you take the time to sit down and explain to the patient either their medical condition or the medicine you're prescribing or your plan of action in kind of the simplest terms that you can. To make an appointment with me, please call the number on the screen.